I am a pharmacy from Institut Jantung Negara. This video is regarding Warfarin patient education. This video is for educational purpose only. Remember to always follow the manufacturer's instruction. In this video, we will talk about what is Warfarin and how it works, why do you need Warfarin, what is INR, how to take Warfarin, things that affect Warfarin, possible side effect of Warfarin and precautions to take while taking Warfarin. Warfarin belongs to a group of medicine called anticoagulant. It is commonly referred to as a blood thinner, but it does not actually thin the blood physically. If you already have a blood clot, Warfarin will not dissolve this clot. It will stabilize the clot so that it will not grow bigger. It reduces the ability of your bloods to clot. This picture demonstrates how Warfarin works in our body. Before we use Warfarin, our body produces vitamin K to help form blood clotting proteins. This blood clotting protein hold blood cells together to form clots whenever the blood clotting process is initiated. When we start taking Warfarin, the Warfarin target vitamin K which interfere the productions of blood clotting proteins. As a result, lower level of clotting proteins are produced and blood cells are less likely to form clots after Warfarin. As a result, our blood will take longer to form clots. Warfarin is prescribed for people who at increased risk for development harmful blood clots. A clot can slow or block blood flow. Warfarin is also used in people who have previously developed harmful clots. Warfarin prevents further complications, for example, stroke, heart attack, and clots from moving to other parts of the body. Some of the common indications where Warfarin is prescribed, for example, patients with heart valve repair or replacement. Different types of valves are used. It could be a mechanical valve or tissue or bioprosthetic valve. Warfarin is also prescribed for patients after Fontan or Bentel procedure. Patients with atrial fibrillation (AF), where the risk of stroke is 5 times higher compared to normal heartbeat person, and for the patient with risk of deep vein thrombosis, blood clot in leg, or pulmonary embolism, blood clot in lung. Warfarin is available in the market in different strengths with different color. Be very careful to remember the dose and not the color of the tablet. INR stands for International Normalized Ratio. It is specific blood test to check for your response to Warfarin. It measures how long it takes for your blood to clot while you are taking Warfarin compared to how long it should normally take. INR reading is typically 1 period to taking Warfarin. It needs to be higher for someone who taking Warfarin. The target INR is 2 to 3 for atrial fibrillation, pulmonary embolism, DVT, and bioprosthetic or tissue valve replacement, whilst the INR is 2.5 to 3.5 for mechanical valve replacement. Please note that this target range may be modified and individualized for you by the doctor. Check with the doctor or nurse regarding your target INR if you are unsure. The higher the INR, the longer it takes the blood to clot. If your INR is 2.5, it suggests that it is roughly taking your blood 2.5 times as long to form a blood clot than it did before you start taking Warfarin. The result of your INR test will determine the dose of Warfarin you need to take. Now we will look at how does INR affect your Warfarin dose. If your INR target is 2 to 3 and the INR result come out as 2.5, this means that the reading is within target range. The current dose is appropriate. However, if your INR reading is 1.3, it means that the reading is low, blood is thick, risk of clotting is high. Warfarin dose may be increased. If your INR reading is 3.8, it means that the reading is high, blood is thin, which is risk of bleeding is high. Your Warfarin dose may be decreased. Now, we will look at when and where you can test your INR. Patient will be required to test INR quite often initially. Upon discharge, you will be given a very short duration of supply for warfarin. You should not stop taking warfarin when the medication supply finish. Subsequent supply of warfarin will be based on INR result. Then the frequency of INR testing will be reduced gradually. Maybe once a week, once every 2 weeks, once a month, and etc. Once your INR results stabilize within the target range. Bring along your warfarin record book for INR testing when nurse will be supplying before discharge. Fasting is not required for the INR test. You can choose to test your INR at IJN or nearest government or private hospital. Kindly request for the INR monitoring letter from the doctor or nurse before discharge if you are intended to check your INR in another hospital. Warfarin is to be swallowed by mouth. It is taken only once a day, best in the evening and around the same time every day. It can be taken either before or after food. It may be taken together with other medication. In the case where you forget to take a dose of warfarin, if you remember within 8 hours from your usual dosing time, you should take your usual dose as soon as you remember. It is more than 8 hours from your usual dosing time, do not take the missed dose but take your usual dose at the usual time. Do note that even one missed dose may affect your INR. Here is an example. Let's say you are supposed to take your warfarin at 6 p.m. on 29 April, but you have forgotten. If you remember before 2 a.m. on 30 April, which is within 8 hours, you can take the warfarin dose. If it is after 2 a.m., let's say it's already 6 a.m. of 30 April, do not take the dose and wait until 6 p.m. on the 30 April for your next dose. Do not double up your warfarin dose. If you have missed 2 or more consecutive doses, please have your INR checked. Here are some things to do if you cannot remember whether you have or have not taken the medication. Please do not take the warfarin for that day as you may have already taken the dose earlier. You may make a note of the date and inform the INR clinic or the doctor or pharmacy or clinical staff during the next blood test appointment regarding the missed dose. It is advisable to use prompts that will remind you to take your warfarin, like pill boxes, setting alarm on the phone, or crossing out on the calendar. The durations of warfarin treatment depends on your medical condition. The indication list is in the table. Here are some examples of warfarin treatment. Your doctor will determine how long you have to take warfarin. Do not stop taking warfarin without consulting the doctor first. It is very important for you to remember 3 things: why warfarin was prescribed to you, your target INR, and how long you will have to take your warfarin. There are a number of things affect blood clotting and therefore affecting your warfarin treatment. Some supplements, medicine, and food can interfere with warfarin effectiveness by decreasing the effect of warfarin, which result in increased risk of clotting, or by increasing the effect of warfarin, which result in increased risk of bleeding. To make sure your warfarin is working safely and effectively, it is important to follow the following advice. Here are some common medications that can affect warfarin. For example, painkiller or medication to relieve fever and antibiotics. It's safe to take paracetamol while you are on warfarin, but take at a lower dose of 1 tablet, 500 mg at a time. Taking more paracetamol than this may make your blood slower at clotting. This puts you at risk of bleeding. If you are still in pain after taking paracetamol for 3 or 4 days, speak to your pharmacist or doctor. Other blood thinning medications such as aspirin, clopidogrel, and others can affect warfarin too. Here are some herbal or traditional medicine that can affect warfarin, such as ginseng, dokwan, gamat, tongkat ali, and kacif Fatima. Next are some common supplements that affect warfarin, such as ginkgo, fish oil, garlic peel, glucosamine, coenzyme Q10. Coenzyme Q10 might decrease the effectiveness of warfarin. Decreasing the effectiveness of warfarin might increase the risk of clotting. Be sure to have your blood checked regularly. The dose of your warfarin might need to be changed. You may or may not be able to take this medicine, herbal or traditional medicine or supplements. You must check with your doctor or pharmacy before you take this medicine, supplement, herbal or traditional medicine. Your INR may need to be checked more often. Your dose of warfarin may be adjusted while you are taking this. Here are some examples of food that can affect warfarin by reducing the INR reading as they contain high level of vitamin K. Vitamin K opposes the actions of warfarin. Maintain a healthy diet with consistent intake of food with vitamin K. You are not encouraged to stop taking your vegetable completely. Eating an increased amount of food rich in vitamin K can lower your INR, making warfarin less effective and potentially increase the risk of blood clot. You should aim to eat a relatively similar amount of vitamin K each week. A consistent amount of vitamin K intake will lead to fluctuation in INR reading. For a more complete guide, consult your dietitian. Inform INR clinic if you plan to go on vegetarian diet for a specific duration or if you have a loss of appetite recently. In regards to alcohol intake, it is not recommended to have more than 2 standard drinks per day. A standard drink is a beer glass of beer, a wine glass of wine, a nip of spirit. However, glass and bottle size can vary, as can the concentration of alcohol. Avoid any excessive or binge drinking which can increase INR and increase effect of warfarin. For further information, please check with your dietitian. You can drink alcohol while taking warfarin as long as you stick to the national guideline of no more than 14 units a week for men and women. A standard glass of wine, 175 ml, is 2 units. A pint of lager or beer is usually 2 to 3 units of alcohol. Drinking heavily, especially binge drinking lots of alcohol in one go, is dangerous while taking warfarin. The alcohol can increase warfarin's effect and in turn increasing the risk of bleeding. Now let us look at some of the possible side effects of warfarin. Like all medicine, warfarin can cause side effects. Do not be alarmed about these side effects. You may not get any of them, but you need to know what to do if they occur. Stop taking warfarin and go to hospital immediately if you have an allergic reaction to warfarin. The type of allergic reactions include swelling on the face, lips, tongue, difficulty breathing, severe itchiness of the skin with lump. Unexpected bleeding is one of the possible side effects of taking warfarin. Some of the side of bleeding are headache, dizziness or weakness, unexplained nosebleed that are severe or frequent, pink, dark brown or brown urine which may indicate bleeding in the bladder or kidney, black, sticky stool or bleeding from the back passage which may indicate bleeding in the stomach or intestine, after a serial fall or head injury, even if there are no other symptoms, vomiting blood or particles that look like a coffee ground, or heavy bleeding or oozing from cuts or wounds. Major and unusual dark process under the skin, dark, red or black area on the skin. When you do encounter the situations as mentioned, please visit the nearest hospital and get treatment immediately. Please inform the doctor or pharmacy or nurse if you experience any of the following: bleeding from the gum after brushing the teeth, swelling or pain at an injection site, excessive menstrual bleeding or bleeding between menstrual period, diarrhea, vomiting or inability to eat more than 24 hours, and fever. All of this may have different implications to the INR reading of which the healthcare professional should know. Lastly, let's look at some of the precautions you can practice while you are on warfarin. Reduce the risk of bleeding by considering to make some of these changes. Use a soft bristle toothbrush. Shave with the electrical razor rather than a blade. Take care when using sharp objects such as knife and scissor. Avoid activity that poses risk of falling or injuries such as contact sports. Apply pressure to minor cuts and use ice as cold compress to reduce the swelling in bruises. Do not rub or massage any of the bruises, and see doctor if the bruises is larger or the wound is bleeding for more than 20 minutes. Remember to inform your dentist before you going for dental extraction, your surgeon before going for surgery, your doctor or medical staff who is treating you that you are taking Warfarin before receiving any treatments or medicines, as they may need to advise you on the appropriateness of Warfarin with their treatments. Always have extra supply of tablets if you are going on holiday. Try to prevent falls. Do inform your Inr clinic staff or doctor if there is a change in your smoking status, as these changes will affect the Inr result. For ladies, talk to your doctor before you plan to become pregnant. We have come to the end of the video. Thank you for your kind attention. For more information, please contact Pharmacy and Supply Department of Institut Jantung Negara.